This is a study of 24 years old unmarried female, young girl with the history of pain in the abdomen, that's all. No history of any anomaly relating to abnormality or problem relating to the menstrual cycle. Now what are we seeing is strange finding, keeping in view the history of this young girl, that what I am going to show you, to first of all see that this is the just first of all concentrate on the area that I am showing you. This is the urinary bladder in longitudinal section. Now this is the vagina and this area, and this is the cervix. This is the cervix. You can see the cervical canal. Forget about these things, but concentrate on this region, please. This is the cervical canal, and when I follow the this canal, it just a minute. Yeah, here we go. This is the uterus. In fact, now see, I was following the cervix, and then this is the endometrial lining, followed it, and this is the uterine outline. It is a retroverted, measures approximately 8.6 by 2.9 centimeter, and is stretched, appears to be stretched, you know. So this is the uterus. This area is the, from here, this is the anterior myometrium, this is the posterior myometrium. Now you see that the outer surface is not that smooth, regular. This is the longitudinal section of the uterus. I forget about other things. Concentrate on this one. And you see that the outer border, the posterior myometrium is fine, but the outer surface of the anterior myometrium, you see, is irregular. So, and the endometrial canal is clear. It's in the early proliferative phase. So this is first part of this study. And this was an incidental finding, as when you are not being given any history, and she did not feel it even, the hardness of what you are going to see. So innocent our girls are, that they, now she had pain, and if she did not have pain, she would have not even reported yet for her ultrasound. Now I'm going to go into transfer section. When I go into transfer section, you will see two cystic areas. This is the transfer section, and there is, you will see this is a cystic area relating to the left ovary, TUBO ovarian, measuring approximately 3.6 into 3.8 centimeter, and not only that, outer surface is regular. Posterior wall acoustic enhancement is seen. You can see debris within it. You see these echogenic areas within the lumen of the cyst is consistent with the debris in it, and this is left TUBO ovarian. Now, when this is the uterus, just to show you again. This is the uterus. This is not an ovary, because when I apply, you see this color box, you can see the vessels straight away. So this is not ovary. These are vessels. Now when I move the probe now further, posteriorly and towards the right side, I see a large tubular structure extending from the right adnexa. You see, this is the region of right adnexa, and now when I go medially and posteriorly, I see a large cystic area that measures approximately, this is just an approximation, 10.7 centimeter by 6.2 centimeter, and if I try to get the approximate volume of this cystic area, it is okay. This will be a rough approximation. This is the longitudinal section of the cyst. I'm sorry. Now you see something around 211 ml, but when surgical intervention or will be done, it will be more than that, something around 200 to 250 ml. Now this is the another pathology. So we saw a complicated cyst with echoes on the left side. Same we are seeing on the left side. I'm going to magnify for you. And see, let's see. No flow, nothing. Debris is seen. You see debris in it. This is all debris. This is all debris. Note the degree of posterior wall acoustic enhancement here. This is the cervix, this area. So this is the finding number 2. Now when I move now I'm going to move the probe in the midline, and I will be going up to the epigastric region. Share with me. There is a large mass. Now I am in the epigastric region. You see, this is the liver. This is the liver, the aorta, and here is when I move the probe medially, you see, here it comes. This is the liver, bowel gas shadows, and here is the large mass that extends on both sides of the midline, and I can trace it down up to the pelvic region, extending from the right side. So this is a large fibroid that extends from the right region of the right adnexa. This is the right tubovarian cyst, and this is the cystic and solid mass of large fibroid, and the pain she suffered was because of the cystic areas that you are seeing, which are the areas suggestive of, this is one of them, second, third, fourth, fifth, sixth. She had pain because of internal necrosis or degeneration or hemorrhage. Now when applied this color Doppler, you can see there are vessels within it. It's a vascular sort of a solid inhomogeneous mass, echogenic mass with interspread numerous cystic areas and blood vessels seen throughout this mass. So can we think of some other pathology apart from fibroid? Okay, now This is the transfer section. Here, these are the iliac vessels. This is two. Okay. Here you are seeing iliac vessels. Here, these one. You see the connection of this cystic, this solid mass with the right end. So this is our case of the day. Thank you very much.